The PLATO Trial, or Platelet Inhibition and Patient Outcomes, was a landmark study comparing two antiplatelet drugs Ticagrelor and Clopidogrel in patients with acute coronary syndrome (ACS), a term for life-threatening heart conditions like heart attacks or unstable chest pain. Conducted across 43 countries from 2006 to 2008, this trial involved 18,624 patients and aimed to determine which drug better prevented cardiovascular events like heart attacks, strokes, or death. Trial design patients were randomly assigned to two groups. Ticagrelor, a 180 mg initial dose followed by 90 mg twice daily. Clopidogrel, a 300 to 600 mg initial dose followed by 75 mg daily. The study was double-blind, meaning neither patients nor doctors knew which drug was administered. The primary goal was to compare the risk of a composite endpoint, a combined measure of cardiovascular death, heart attack or stroke, within 12 months. Secondary goals included evaluating bleeding risks and stent thrombosis. Key results: after 12 months, 9.8% of Ticagrelor patients experienced the primary endpoint, death, heart attack or stroke, versus 11.7% with Clopidogrel. This translated to a 16% lower risk with Ticagrelor, represented by a hazard ratio (HR) of 0.84, a statistically significant result. P equals 0.0003. Survival analysis. The Kaplan-Meier curve, a graph showing survival probability over time, demonstrated early and sustained separation between the two groups, with Ticagrelor's benefits appearing within 30 days. Critical subgroups. Non-STEMI patients, 16% lower risk with Ticagrelor. Chronic kidney disease, CKD 23% risk reduction. Diabetes, consistent benefit without increased bleeding. 50. Major bleeding rates were similar, 11.6% versus 11.2%, but Ticagrelor had slightly more non-CABG bleeding, for example gastrointestinal or nasal bleeding. Technical terms explained. Composite endpoint, combining multiple outcomes, e.g. death plus heart attack, to assess overall treatment impact. Hazard ratio, HR, a statistical measure of risk reduction over time. An HR of 0.84 means Ticagrelor reduced risk by 16%. Kaplan-Meier curve, a visual tool to estimate survival probability. The wider the gap between lines, the greater the treatment benefit. Stent thrombosis, blood clots forming inside a heart stent. Ticagrelor reduced this risk by 33% compared to Clopidogrel. Why PLATO mattered. Ticagrelor's reversible binding to the P2Y12 receptor allowed faster, more consistent platelet inhibition compared to Clopidogrel, which requires liver activation and has variable effectiveness. PLATO proved Ticagrelor. 1. Reduced cardiovascular death by 21%. 2. Prevented more heart attacks and stent clots. 3. Had no overall increase in life-threatening bleeding. This led global guidelines to recommend Ticagrelor as a first-line therapy for ACS. However, its twice-daily dosing and higher cost are trade-offs. Beyond PLATO, long-term use. Later trials like PEGASUS-TIMI 54 extended Ticagrelor's use to patients with prior heart attacks, showing long-term protection against recurrent events. In THEMIS, Ticagrelor reduced heart attacks in diabetics with stable heart disease but increased bleeding, highlighting the need for personalized treatment. Conclusion. PLATO transformed heart attack care by proving Ticagrelor's superiority over Clopidogrel in saving lives and preventing clots. While bleeding risks require careful monitoring, its faster action and reliability make it a cornerstone of modern cardiology. Always consult your doctor to weigh benefits and risks for your unique condition.